So without further ado, I'm very pleased that today we're supported by the Ministry of Housing, Communities and Local Government, and I will hand over to your chair for the reset session, which is Tia Matthews. Hi Tia.
I lead the home adaptations team in the Ministry of Housing, Communities and Local Government. So we have responsibility for the Disabled Facilities Grant, but also support for home improvement agencies and any other policy around adaptations that are made to people's homes, particularly for older and disabled people. And I also do some work on trying to bring together the housing contribution to lots of health strategies. So this conference and lots of the things that many of you have raised already are of particular interest to me as I try and do lots of work to bring together MHCLG with our counterparts over in the Department of Health and Social Care. So they asked me just to briefly say if there's anything government would particularly welcome. And at the moment, government is quite open to pretty much any new ideas that people have, but also knowing about all of this best practice that is happening at the moment. And we know a lot of you are still right in the midst of the response and finding the right ways of working and looking to the future. So it'd be good to bring together as much of that as possible, as Paul talked about as a result of this conference. I would like to very much stress that your contribution so far, both the speakers, but also all of you participating with the polls and the chat and your questions, are bringing up some really useful and important points that I know Paul and the other organisers will be capturing and making sure that they share with us afterwards. So please do keep contributing. There's been a few ones that are really have stuck out to me. So I'm using my tiny bits of paper because my IT isn't even enabling me to type while I am on a Zoom call today. So a couple of the things that have really stood out to me so far, right from the beginning, around getting people to think about housing and care as their needs change, which I think was one of the things that Lynn Jardine put in as a really early question, and getting people to think about what they need before they get to crisis point. But also so many of the great examples that we've already heard, and I know we're going to hear in the next two sessions as well, around closer relationships that have been built over the last few months, and thinking about how we can continue this into the next few and hopefully changing the system permanently. For me as well, there's been some really important points around disabled facilities grants and home adaptations. Really support the strong messages about needing more occupational therapists, but also all the other roles that go into getting people the support that they need. So thank you very much for James and several people who commented as well on the Q&A and on the chat about support for that point. And as part of that as well, Sheila McIntosh also raised the importance of home improvement agencies as the kind of service that people access for specific assistance, but then it helps build relationships with lots of others as well. And I think that's one of the things that we'll see in the next session as some of our speakers talk around the different ways that we've tried to reach out to communities. I'm using the big collective we here, not just government, in order to build those relationships so that we can start getting people the support, access to the right support that they can get from other areas as well. And as Paul set out right at the very beginning, home is absolutely vital to all of us. So we're really interested in all the messages that you can bring out around housing as part of the package around health and care at the same time. And one of the things that James Bullion said right at the beginning around every care decision is a housing decision, echoing again what the Minister said as well about the importance of all of them working together. And I'm really pleased that my team gets to work so closely with DHSC, and also that links very nicely into Gill Leng, because I've done quite a lot of work with her as well. So she is a housing advisor for, sorry, I am saying the wrong thing. She is the Health and Homelessness Advisor at Public Health England, but we've done a lot of work over the last few months trying to bring things together across both departments and that side as well. So I'm going to pass straight over to Jill to start talking.
Thank you, Tia. I'm great. I'm so pleased I've got slides and you don't have to see me. That's amazing. So I'm Gill Leng. Thank you for the intro. I'm currently Health and Homelessness Advisor employed by Public Health England, but I'm in a very lucky position, I think, in that I actually sit across two government departments and two arm's length bodies, funded by Department of Health. I've been working in MHCLG for over 2 years now, and I'm still based in MHCLG. But yeah, like I say, I work for DH, I work for Public Health England, and I spend a lot of my time working with NHS England and improvement. So I know there's probably many of you on this call, on this conference, who are in a similar position or think that that's perhaps the position you'd like to be in. But it has its challenges, but I definitely would say in terms of what we can achieve together by working across the departments and the exec agency and the bodies, it's been worth it so far. So what I'm going to share today really is a reflection, having worked across that kind of system, particularly in the response to people experiencing rough sleeping during sort of COVID times. But also, I suppose what I wanted to do was just reflect back on where I think more recent experiences have left us against the kind of existing ambitions we had for people experiencing not just rough sleeping, but homelessness more generally, and individuals and households' health and well-being. And really, I want to leave most of the time for some Mungos who are going to talk about, in practice, what they've done to respond to people experiencing rough sleeping during COVID. So yeah, I'll just kind of sort of briefly start really. I think the first thing to say, and I think Tia kind of alluded to it, and I'm sure you've talked about it already today, homelessness is not just a housing issue, and homelessness is very much and has always been a public health crisis, and a real sign of health inequity and health inequalities in society today. And all COVID-19 has done is essentially make this far more evident, which I think is a real positive. One of the struggles we've always had with homelessness for any population is that it's actually really not very, very visible, and most visible form is obviously people experiencing rough sleeping. But in terms of numbers, that's a very small population compared to the overall population, and it makes it very, very challenging actually for this population to be prioritised in any way, shape or form. And I suppose that does, we know, contribute to very significant ill health, both physical ill health, mental ill health, and unmet care and support needs, particularly amongst people experiencing rough sleeping. But obviously, people don't just suddenly move from one situation to another situation. People, people end up in difficult housing circumstances, sometimes as a consequence of their health and care needs not being met earlier on. So there's definitely some more we can do around prevention. Particularly around people experiencing rough sleeping, they experience very significant comorbidities or co-occurring needs. So quite often you'll hear about drug or alcohol use and mental ill health, but that's not, that's not for everybody. But other people have many more sort of long-term respiratory conditions, heart and lung conditions that make people very, very vulnerable to ill health as a consequence of COVID. And therefore, when we were thinking about what do we need to do in response to COVID and to protect people and to keep people safe, getting people sort of off the streets, keep getting people out of unsafe housing environments or home environments, was absolutely a priority for government, and that is what has led to the kind of getting everyone in policy that was introduced sort of in end of March. So just to kind of, I suppose, to reflect back on sort of where I think COVID leaves us, I suppose before COVID-19, the government already had a number of ambitions, both around improving health and wellbeing and reducing health inequalities, preventing homelessness and ending rough sleeping. And that's what you can see on this slide in front of you now. And then across the Ministry of Housing, Communities, Local Government, Department of Health, NHS England and Improvement and Public Health England, we had and have been for the last 2 years working towards sort of 3 outcomes really, or 3 things that we felt needed not to be in place, or we needed to work on to make sure that those ambitions could be achieved. And that was that, obviously I mentioned before, that ill health and health conditions don't lead to someone becoming homeless in the first place. If you are experiencing homelessness in any shape or form, that doesn't prevent you from accessing services, and actually the impact of homelessness is in some way mitigated for you, and that if you are someone with ill health or health condition, that doesn't prevent you from moving on from homelessness. And we know that that's quite problematic for some people, is that once they find themselves in that experience of homelessness in whatever shape or form, it can be very, very difficult for them to move on from that if their health care needs aren't addressed at the same time or recognised in those plans to move people into accommodation, which is very, very relevant to kind of what the next steps are in relation to COVID. Next bullet point, if you just press the slide. There you go. Just to kind of add the COVID layer to it, because I think what we're trying to do is to think that, you know, what we want to do is to learn from what we've experienced through responding to COVID, but building on those ambitions and outcomes that we're still aiming to achieve. So with COVID-19, I think, you know, like I say, our priority initially was very much keeping people safe and enabling people to access emergency accommodation, or preventing people from losing homelessness. So, for example, those people living in the private rented sector. And that remains a priority going forward as we're looking to move people from emergency accommodation into the community or into settled accommodation. Keeping people safe from COVID is absolutely a priority for us at the moment. The other thing that we're working towards is recognising that people who have moved into emergency accommodation, we've seen some really phenomenal outcomes. Unsurprising to me, who's worked in health and housing for a very long time, if you give someone somewhere nice to live with access to a bathroom and maybe food and support and company, they generally tend to see improvements in their health and well-being, and that's definitely been the case for many of the people that we have been keeping information about. And what we don't want to do is lose those things that we've made through the process of resettling people into the community. So that's very much another priority for us. And then the final point with COVID-19, it's definitely not the case that it's led to a better outcome for everybody. In fact, some people have become homeless for the first time as a consequence of COVID-19. And we also know that there are people for whom actually the response that we've been able to offer hasn't got people off the street. So there are people still who may have moved into emergency accommodation who have returned to the street or have felt, actually, this isn't for me, or I don't feel safe here. And what I don't want us to do is to ignore the fact that it's not just that we've got everybody nicely accommodated and we're going to move people on. There are still people who are outside of that population who we need to meet. So we need to really bring everyone with us. Next slide. I suppose the other thing, just to reflect back on, we're not starting from a blank sheet. So COVID's obviously come along, and, you know, people said to me right at the start, Jill, this is perfect. Well, not perfect in the sense for anyone's health and well-being, but insofar as it was really evident early on that all of the things that have been bugging me and colleagues working in health and homelessness for ages, and I saw someone commented about hospital discharge, all of the things that we knew weren't working for people experiencing homelessness suddenly needed some form of resolution if we were going to keep people safe. And so, you know, COVID-19 has very much been an opportunity for us to re-tackle some of the barriers that we've experienced for quite a long time. And what I'm quite keen on is that we don't lose those opportunities. We make sure that we learn and take that into kind of, I suppose, what might be business as usual going forwards. But like I said, we weren't starting from scratch, and the two pieces of two publications that I've got on this slide here actually were published during COVID, so have probably been missed, but are really, really relevant to what we do next. And the first is this positive practice briefing from the Local Government Association and from ADAS around adult safeguarding and homelessness. And this was something that Department of Health sort of commissioned through the Care Health and Improvement Programme. Very much led by experts in safeguarding, to look at, you know, why is it that we are seeing safeguarding adult reviews, people experiencing death and neglect, who are experiencing homelessness, and what is it that we can learn. And the document is so useful on many fronts, but I think for me one of the things it neatly does is really highlight that actually we're talking about people with care and support needs, or quite likely with care and support needs, who actually we need to think about when we're also thinking about other populations who might be, you know, in need of an assessment, in need of access to care and support. And generally speaking, our populations haven't been considered in that way by everybody. So that's a really useful briefing. Lots of really helpful stuff in there. The letter from Minister Hall that went to local housing authorities around how do we move people on safely from emergency accommodation highlights the importance of safeguarding and understanding that it's not just, you know, safeguarding out reviews and after the event, but we need to be thinking about vulnerability and safeguarding in everything that everyone does. And the second document there was published by the King's Fund, again, just as COVID started. And that's a really useful resource, provides a checklist of 10 things really that the King's Fund is thinking needs to be different in the housing, health and care system, so that we can enable better health outcomes for people who are sleeping rough. And it's called Going Above and Beyond. I would say that's a really fair reflection of what everybody I know working on COVID, health and homelessness has been doing over the last 4 months now, certainly since I've been working on it. But I think we've made progress during COVID, and quite a number of those points there that I've highlighted from the King's Fund, not, you know, obviously from finding and engaging people sleeping rough, but like I say, I think the workforce has been absolutely phenomenal on all fronts, and that's healthcare, that's allied health, that's public health, drug and alcohol, housing, homelessness has all really sort of come together and worked in a very, very difficult situation to overcome some pretty difficult problems. So that's one of those things where I hope we can really sustain that going forward. Next slide. The only other slide, because I think I've probably run out of time, have I, Tia? Yes. I mean, this is the only other slide I was going to kind of really sort of leave you with, and I suppose it reflects back on the kind of ambitions. But I suppose at a local level, what we're trying to do now across sort of government departments, PHE and NHSE, is to really support local authorities, healthcare, social care, public health, to come together and think about, you know, what does this house, what do these services, what does this commissioning, what does all of this, how does all of this come together for an individual, for a household, so that we can, you know, move people on safely in their lives. I don't just mean from kind of COVID, but if we've accommodated people or if we've prevented people from becoming homeless, you know, now really is the chance for us to bring all of this together in a way that we haven't done before. This has obviously got a slight COVID lens to it, because like I said before, our priority remains keeping people safe from COVID. And going forward, we do need to think about how do we do that if we have a second wave, if we have an overlay of flu going forward. You know, the virus hasn't gone away. We're going to need to behave and work differently for some time to come. And this diagram really is intended to sort of try to capture how we might sort of come together to enable people to have a home that meets their breadth of needs. I think the only thing I suppose I wanted to finish on, for me anyway, personally, I'm not a keen advocate of business as usual and of us returning there as quickly as possible, because it wasn't good enough for people experiencing homelessness or at risk of homelessness, or indeed any inequalities. And I think going forward, any policy or programmes that we across government or with partners develop need to really think hard about how we recognise health inequalities, health inequity, and the role of home in that. Yeah, and we just absolutely need to not lose sight of what COVID has really laid bare around inequity, inequalities, and homelessness within that. So I think that's it from me.
That's brilliant. Thank you very much, Gill, for that very quick but quite a substantive summary of what has been done and what you think we should be thinking about as we take this forward.